Welcome back, everyone. And today, I've got something a little bit different for you. We're going to talk about an ailment that lurks within our hearts and strikes when we least expect it. It often goes unnoticed, silent, and deadly. The culprit is heart muscle disease, also known as cardiomyopathy. And it is a lot more common than you might think. Every year, cardiomyopathy claims the lives of over 60,000 Americans, and in some cases it can go undetected for years, only revealing itself through a sudden cardiac arrest. For instance, just 2 months ago, 22-year-old footballer Christian Eriksen collapsed during a match in front of thousands of spectators due to cardiac arrest brought on by undiagnosed hypertrophic cardiomyopathy. This condition can strike anyone regardless of age or athletic ability. But what exactly is happening in the human body? How do you recognize its warning signs? And most importantly, what can you do to protect yourself against this silent threat? Today, we'll delve deep into each of these questions and shed light on this often misunderstood condition. At the end of the day, knowledge is power, and we want to make sure you are equipped with all the facts so you can take charge of your health and live a longer, happier life. So let's jump right in. Chapter 1. What is heart muscle disease? Heart muscle disease is a term that encompasses several diseases marked by the deterioration of the heart muscle, affecting its ability to pump blood effectively. It is important to distinguish cardiomyopathy from other heart conditions, such as coronary artery disease, which is characterized by clogged arteries. Cardiomyopathy specifically targets the heart muscle itself. Chapter 2. Types of heart muscle disease. There are 4 primary types of heart muscle disease. Dilated cardiomyopathy, where the heart's main pumping chamber widens and thins, leading to a weaker heart muscle and reduced blood circulation. Hypertrophic cardiomyopathy, where the heart muscle becomes abnormally thick, making it harder for the heart to pump blood and increasing the risk of blood clots. Restrictive cardiomyopathy, where the heart muscle becomes stiff and rigid, restricting the heart's ability to fill with blood. And finally, arrhythmogenic right ventricular cardiomyopathy, where the heart muscle is replaced by scar tissue and fat, disrupting the heart's rhythm and increasing the risk of stroke. Each type presents unique challenges and requires specific management strategies. Understanding the nuances of each is crucial for effective diagnosis and treatment. Chapter 3. The silent symptoms. The early stages of heart muscle disease can be tricky to spot. Some people might brush off symptoms like persistent fatigue or occasional fainting spells as just another rough week at work, or maybe just not getting enough sleep. But here's the thing. Ignoring these red flags could be disastrous. As the disease progresses, it can lead to an irregular heartbeat, shortness of breath, and swelling in the legs due to fluid retention. You see, the heart's job is to pump blood, which carries oxygen and nutrients throughout the body. But as the disease takes hold, it starts to lose its strength and efficiency. This means that instead of smoothly circulating blood, it begins to slow down and can even start to leak blood around the heart muscles. Over time, this can cause fluid to build up in the lungs, making breathing increasingly difficult. And that's not all. The heart muscle itself can start to stiffen and enlarge, putting a strain on the heart's electrical system and leading to potentially life-threatening arrhythmias. It's like trying to run a marathon with weights on your legs and a drum solo playing in your ears. Not a pretty sight. Chapter 4. Causes and risk factors. Did you know that genetics play a significant role in heart muscle disease? If you have a family history of the condition, it's essential to be extra vigilant about your heart health. But genetics isn't the only factor. Our lifestyle choices also play a big role. Regular alcohol consumption, drug use, particularly cocaine, obesity, and high blood pressure can all contribute to the development of heart muscle disease. Additionally, viral myocarditis, where viruses attack the heart muscle, can sometimes lead to chronic heart muscle disease. Autoimmune conditions in rare cases linked to chemotherapy, drugs, and radiation therapy to the chest area can also play a role. Basically, it's a complex interplay of nature and nurture, so understanding your risk factors is the first step to taking control. Chapter 5. Diagnosis. The road to diagnosing heart muscle disease can be a bit of a maze, often requiring multiple tests and evaluations. But don't worry, we've got you covered. The journey usually starts with a standard ECG, which measures the heart's electrical activity. Next, an echocardiogram comes into play, creating images of the heart to check for size, shape, and movement abnormalities. In some cases, A cardiac MRI is used to get a detailed look at the heart's structure and function, and if needed, a biopsy of the heart muscle can provide insights into the underlying causes of the disease. The goal of these tests is to create a comprehensive picture of your heart's health, enabling doctors to make an accurate diagnosis and develop a tailored treatment plan. Remember, knowledge is power. By understanding the diagnostic process, you can actively participate in your healthcare decisions and advocate for the best course of action for you. Chapter 6. Treatment and Management. The treatment for heart muscle disease varies depending on the type and severity of the condition. However, there are some common approaches that can help manage the symptoms and improve quality of life. Medications like beta blockers and ACE inhibitors are often prescribed to help regulate heart function and reduce blood pressure. Diuretics may also be used to remove excess fluid from the body. Alongside medication, lifestyle changes can significantly impact the progression of the disease. These include adopting a balanced diet, incorporating regular exercise, and reducing alcohol intake. For some, more advanced therapies, like an implantable cardioverter defibrillator, ICD, may be considered to help regulate heart rhythm and prevent sudden cardiac arrest. In more severe cases, a heart transplant might be the best option. But here's the exciting part. The field of medicine is constantly evolving, and there's hope on the horizon. New therapies like gene therapy and regenerative medicine are showing promise in treating certain forms of heart muscle disease. The future may hold even more targeted and effective treatments, giving those affected by this condition a better quality of life. It's a reminder that while the journey with heart muscle disease can be challenging, it's not without hope. With proper medical care, lifestyle adjustments, and new therapies on the horizon, individuals diagnosed with this condition can still lead full and active lives. It is a testament to the resilience of the human spirit and the dedication of the medical community to find better treatments and ultimately a cure. Chapter 7. Living with heart muscle disease. Living with a heart muscle disease diagnosis can be overwhelming, but it doesn't have to define your entire life. Take, for example, the story of Sarah, a 35-year-old mother of two who was diagnosed with dilated cardiomyopathy a few years ago. Initially, she felt lost and unsure of what to do next, but with the support of her loved ones and her healthcare team, she learned to manage her condition. Sarah made some simple lifestyle changes, such as cutting back on salt and sugar, and started taking long walks every day. She also worked closely with her doctor to find the right medication regimen to help regulate her heart rhythm. Another inspiring story comes from David, a 62-year-old grandfather who was diagnosed with hypertrophic cardiomyopathy. Despite his diagnosis, David refused to let it slow him down. He continued to play basketball 3 times a week and even took up hiking as a new hobby. He works closely with his doctor, monitoring his condition regularly and making adjustments to his medication and lifestyle as needed. Both Sarah and David's stories illustrate that a heart muscle disease diagnosis is not a death sentence. With early detection, proper management, and a positive mindset, you can live a full and meaningful life. It's about making informed choices, staying proactive about your health, and never losing hope. And remember, knowledge is power. The more you understand about heart muscle disease, the better equipped you'll be to manage it. So keep learning, stay curious, and take charge of your heart health, because it's worth it. Your heart beats approximately 100,000 times per day. Don't take those beats for granted. Learn the signs of heart muscle disease. Share this video with friends and family, and protect your strongest muscle. Thank you for watching this episode. If you found it informative, please hit the like button. Subscribe to our channel and turn on notifications so you never miss any of our latest videos. Stay healthy and take care.